Hello, everyone, and welcome to another insightful episode of MedSynapse podcast series. I'm your host, Hetvi Shah, and today we're diving into an incredibly relevant and transformative topic, which is telemedicine and diabetes management. With diabetes affecting millions globally and access to care being a major challenge in many regions, telemedicine has emerged as a game changer. And to shed light on this, we have with us Dr. Sania Bashir from Pakistan, a leading consultant diabetologist, CEO, and founder of Diabetes Telecare. Dr. Sania is not just a clinician but also a digital leader and telehealth innovator, revolutionizing diabetes care through technology. So, Dr. Bashir, thank you for joining us and welcome to the podcast today.
Thank you, Hetvi, and the whole team of MedSynapse. It was really an honor for me that you invited me to talk about a very interesting and I think the need of current era to talk about some digital innovation and especially the role of telemedicine in diabetes management. So I really appreciate the whole team of MedSynapse who is doing great for digital health and artificial intelligence. So thank you so much for inviting me.
Thank you for joining us today, and we're so delighted to hear your thoughts on telemedicine today, Doctor. So before we, just start with the entire discussion on telemedicine diabetes management, could you just share your professional journey with us?
Sure. Basically, my professional journey was seems like some roller coaster because the diabetes, although I'm running a diabetes platform and I'm a consultant diabetologist, but I just wanted to go back in my when I was doing my MBBS graduation. I was a very academic student and having a distinction holder and the gold medalist of my university, and very prone to academic side. And I just wanted to share my thoughts that I wanted to become a very famous pediatrician of the country. But and at that time, I started my pediatric residency as well. But there was some turning point in my professional journey that I have to leave from some personal reasons, pediatrician residency. And then I switched to diabetes education, and I have completed my post graduation from England, Cardiff University, England, and completed my post graduation and then masters in diabetes. That was a turning point that I was facing certain challenges in the diabetes management when I was seeing around that the diabetes is a global epidemic disease. So there are certain challenges which I can see at that time while I was doing my post graduation. So that was the point that I think about something. There must be some platform that should be exclusively for the diabetic, not for the general patients. So that was my professional journey from pediatrician to diabetologist, and that seems something like a roller coaster.
Yes, it was actually a roller coaster journey, Doctor. So now let's start with the big picture. So could you give us an overview of how telemedicine is revolutionizing diabetes management, particularly in regions with limited access to healthcare facilities?
Yes, definitely. As we all know that the diabetes is not a nationwide disease, but it is a global epidemic. And as once I was studying diabetes, I can see that the diabetes is very much spread towards whole over the world. Then I tried to work out on the challenges the diabetic patient is actually facing. That why this diabetes is still not controlled. So once I surveyed all the challenges, the basic and the biggest challenge which I was facing at that time, because in every family has a diabetic patient, the basic gap was there is a communication error between the physician, consultant especially, and the patient. So the patients who are specifically living in the remote areas or the those areas which have very limited accessibility, they have primary care physicians are there, but there are no consultant facilities. And especially the biggest cities where the consultants have very difficult to get appointment of the consultants, and the sitting in the big rows and 4 hour waiting time, and then you cannot explain all your diabetes related problems and issues to the physicians. So that was the biggest challenge which I really faced. And then I thought about that there must be some platform that the physician can easily, especially the consultants, can easily connect with the patient without much moving of the patient from here to there. So that was the biggest thing behind the establishment of diabetes telecare and thinking about the telemedicine. So telemedicine, I think that it's the biggest innovation in the healthcare, that the patient who is actually living in the limited accessibility areas, the patient who is actually moving from city to city, country to country, traveling a lot, there are a lot of people, because the diabetes is not only a disease of a rich person but also a disease of the rural areas and the poor people. So, telemedicine is actually bridging the gap between the consultant and the doctor. And I think this is the biggest statement. And where the doctor and patient communication is there, the patient has, psychological stress relief. He knows that there is someone to whom I can contact wherever I am. Either I am in my country, in my city, in my town, the doctor is with me. So this is the basic concept behind the telemedicine.
Yes, it actually acts like bridging the gap between the healthcare professional and patients, that's rightly mentioned. And also, it is time saving for both, I feel, for the patient as well as the physician as well. Healthcare professionals often struggle with integrating telemedicine into their existing workflows. So, what best practices would you recommend to ensure efficiency and better patient outcomes?
The thing is that uh, I every time when I speak about the telemedicine, and especially my venture, that the diabetes telecare, which I have developed by picking out all the points and customized it according to the needs of the diabetic patient. I know it's very very difficult for every physician to integrate this telemedicine platform, and even surprisingly, I wanted to share to you that I met with a lot of doctors globally and in my country, that they always ask, we really wanted to do some online consultation platform, but we don't know. So my suggestion is that we should use the basic communication tool. And I think you must be very well aware that the WhatsApp facility is that communication tool that is available everywhere, either in the lower areas, either in the the urban areas. So the thing is that the point is that how much the consultant and the physician wanted to bridge this gap. So I recommend that if you are not that much techie person, if you don't know about how to integrate this telemedicine platform into your system, or into your you can communicate. So WhatsApp communication tool, Zoom communication tool,
Mhm.
and there are various other communication tools, the Skype and the bottom and everywhere. So I think that is the less tech communication tool. That is one thing. Number two is that you must work on the proper system. There must be integration of the telemedicine so that the consultants and the patient can communicate with each other. And I must say that after COVID, although the COVID was very worst time for everyone, but that was a blessing for
Mhm.
those who actually wanted to work on the digital platform. So I think the hospital should work on the integration of the telemedicine platform so that at least they can connect the consultants instead of the leaving the patient on the residents and the trainees. The consultant communication should be there.
Yes,
So
I think
that is, I think, the biggest and the basic steps.
Yes, I think the basic steps, like just a one step of ahead, like WhatsApp, simple steps can be taken by physicians to just start with the journey. Uh, Now, doctor, in your experience, are there any specific tools or platforms you found particularly, effective that especially in diabetes care that physicians can start with?
That is what I told, that physicians can start with the basic communication tool, the WhatsApp and the Zoom and the bottom. And I think they are this is the basic step, that the
Mhm.
patient really wanted to show the reports to the doctor. And he or she has to travel from the remote area to the biggest towns where the consultant is available, have to sit in 4 hours raw. And if I must say that the if the male is diabetic and he wanted to consult with the doctor is easy. But if the child is diabetic, and if the female mother is diabetic, or if the pregnant woman is diabetic, the whole family has to travel from the town area to the the biggest city where the consultant facility is available. So you can see the expenditure. Although the patient just wanted to show the reports, or just wanted to change the medication, or just wanted to get the diet plan. So all the primary care facilities can be entertained by utilizing the telemedicine platform, either the WhatsApp, either the Zoom, although the physician can get paid, but that payment and that charges are less than the traveling cost, because the patient is actually reducing their traveling cost, their accommodation cost, their food cost. So the charges can be paid to the physician, but there are a lot of time saved for the patient, saved for the physician, and more time given to those who actually need the hospital management, the tertiary care facilities.
True.
So I think that is the thing, that because we have very much a disturbed ratio of the physician and the patient, a lot of patients and one physician. So if those who actually need the tertiary care facilities can get entertained by that physician on the physical basis, I think that is more beneficial for them.
Yes, I think that's really simplified by you. Now, doctor, how does the effectiveness of telemedicine compare with traditional in-person consultation for diabetes care, particularly in terms of glycemic control and even patient satisfaction?
Yes, this is the biggest question that everyone has to ask, and everyone, there is a myth that if the physician cannot see a patient, then it will not be as much effective. But in terms of diabetes, I must say that there is a lot of difference in between the traditional and the telemedicine approach. I really wanted to elaborate the concept of the telemedicine. Telemedicine does not mean that there is a physician on the video and the patient is taking consultation and that's all. But the telemedicine really become effective when there is a continuous communication between the doctor and the patient. Now what does it mean and how it is actually working? That in the telemedicine in diabetes telecare, I have applied the concept of remote monitoring program. Have you ever heard about the remote monitoring program?
Yes.
The thing is that in the remote monitoring program, what we do is that the patient whose glycemic control is out of the range, or the sugar control really need to require, especially in the type 1 diabetic patient, especially those diabetic who are on the insulin, or especially the pregnant women who are on insulin or on the medication. What we do is that we get them registered on the diabetes telecare platform, and our team is connected to them on the daily basis, and we provide them the 1 month training in which we provide them the continuous education. That was not a single consultation that I did a consultation to my patient and I written the medication and the advice and the patient is gone, and once the patient returned back, the another doctor is actually watching. There is not like that. We registered that patients who need the glycemic control, and after registering them, my team is in being communicated on the daily basis and every meal basis. Like they have to share the breakfast, that what they are going to eat in the breakfast, and the sugar levels before the breakfast, and then we need to adjust the insulin. So it's a 3-time advisory guidance is to be contained. So how the in-person and the telemedicine gives an effective role is that when the patient is being continuous communication with the physician, what are the benefits? Their compliance level will improve. They will more compliant towards the healthy lifestyle. They are more compliant towards their medication, because in the remote monitoring program in the diabetes telecare, we provide the alerts, pop-up alerts customized to that particular patient. Like if the patient is a morning time is 8 a.m., they will receive the 8 a.m. fasting blood sugar level, have to check. So the compliance level is improved. Number 2, adherence towards the medication is improved. Number 3, their psychological stress of being, my sugar level is going low, how to visit to the doctor. It's very difficult to take a time to the doctor. My sugar levels are continuously high. I have to leave the medication. That medicine is actually hurts my tummy. So I have to leave the medication and visit to the nearby physician because I don't have time to visit to the consultant. So that is the point, that how telemedicine is effective opposite to the in-person consultation, that the continuous communication. And I really wanted to share my study over there, that I have published the study of the comparison between the in-person and the telemedicine approach in the diabetes management. And last year in International Diabetes Federation, my poster was published over there, and that was shown 65% improvement in HbA1c. just secondary to the improvement in the compliance and improvement in the adherence to the medication. So the patient get 65% HbA1c control just by their continuous communication with the doctor. It's a 1 year study pilot program which we have published in International Diabetes Federation.
That's really interesting to know about the entire program also, and especially okay, app also. How does it continuously engages the patient with the doctors also, and it's really interesting to know. So, but then one question that was just arising: do you think that patient engagement and trust differs significantly actually in a virtual settings than rather than in person?
Yes, this is again a very common practice, unfortunately, in Pakistan as well as in India. What I believe is that because the patient have a myth in their mind that, the virtual care is not a proper care and we cannot see the doctor virtually. We have to visit to the physician, and in previous concept that the doctor has to touch their pulse so that we will treat. But again, I will give the credit to the Corona, COVID time,
Hmm.
that people used to get aware of the digital phenomena. They have to do their groceries by the digital platform. They have to do their payments they have to do it. There was no option. They have to do it by the digital platform. So I think the people's mindset has been changed, but I must say that this is basically our work that we have to give. Like your platform, MedSynapse, is continuously educating the patient. We are continuously educated. There are so many platforms that we have to give the concept that how the time is saving and how the proper care has been given through this telemedicine platform, and there are no scams like that. So I think this is our work, and we are changing the minds of the people, and people are actually coming towards the online care.
True. I think after COVID, a lot of things has changed also. Now, doctor, with the influx of data from wearables and telemedicine platforms, what strategies can doctors use to analyze and apply this information effectively for personalized diabetes care?
Social media platform, I really started believing that those patients who are actually coming to me through the online mode, they are getting much close to me and very, engaging with my patient. So I started analyzing, and the best way is to analyze is, by having the systematic data recording system, which we at Diabetes Telecare is actually have it, that we analyze it every 6 months, that the how much is patient is incorporating with us and what are the results of this continuous communication. So I think the data integration is very important and every physician has to do it. But unfortunately, the thing is that, Hatvi, that our physicians are not the techie person. They don't know exactly that how to use the digital platform. So I must say that I think this is the need for the doctors to be trained on the digital health platform. So this is basically now the future perspective of the diabetes telecare, that we are starting with the train the trainer project. That now we have done. We are doctors. We are the entrepreneurs. We are the digital innovators. We have done our work. Now we need a lot of doctors to be trained about that platform. So I think we need to train the doctors. Doctors cannot do the technological aspects of the work,
Hmm.
but they have to.
True. I think even doctors need to continuously update themselves also, I think.
Definitely.
Now, Doctor, diabetes often comes with comorbid conditions like hypertension and cardiovascular diseases. So, how can telemedicine platforms be leveraged to manage these effectively alongside diabetes care?
Yes, that is again the very important thing, that the diabetes definitely come with the other comorbid situations. So how the telemedicine can be effective, as I have mentioned, that the telemedicine is actually effective for the primary care as well as the early secondary care treatment. Not the telemedicine is not eligible for the advanced care, and we refer them to the hospital so that in hospital the care has been given to that patient. Now the comorbids, what we can do is that to prevent the early diagnosed case of the diabetes, to prevent them with all the comorbids. First step is that if they are not having comorbid, we what we can do is that by proper taking history, by proper education, by proper advice, we can prevent them from having these comorbids in the future in the early cases of type 2 diabetes. Secondly, what we can do is that by utilizing the platforms, we have to be assured that the people get screened for their blood pressure, for lipid profiles, and for whatever the comorbid we can suspect in that particular patient, like uric acid or thyroid. We have to make sure that the people get used to get yourself themselves screened for these conditions. Again, what we are doing, prevention, the primary care. Third thing is that in the early secondary care, we have to make sure that these things should be under controlled. Under control means that we have to keep an eye on their blood pressure readings. What is the difference? That the patient who is actually visiting to the consultant, they get their blood pressure checked, and okay, he went away. Now what the doctor advised, that you have to come up with me with a 15 days charting of the blood sugar or the blood pressure. Now during these 15 days, if the blood pressure get very much high, who is responsible for being in communication with that patient? Is the doctor sitting on the hospital will be in connected with that patient? No. So it is the telemedicine that the patient come urgently or just drop a message on the diabetes telecare app that I am having this problem. What we do, we rule out what is the cause, and we give them the urgent treatment as well, up till the level that we can manage it at home. That the dose adjustment, a lot of people miss their blood pressure medication dose and then come up with the high blood pressure. They don't expect this thing, or they don't know, that they didn't care themselves that what the mistake has been done. So it is the telemedicine benefit that the patient communicate with the doctor, drop a message, and team has been replied, and we can provide the adjustment of the medication and prevent them from being hospitalization or anything else. So all the comorbids can be managed properly with the continuous monitoring and the continuous communication.
True. I think telemedicine actually offers such a promising solution also for managing different health profiles also, and especially the complex ones. So now, doctor, what training or resources are essential for healthcare providers to overcome resistance and confidently adopt telemedicine for diabetes management? Because even you mentioned earlier that it becomes really difficult for doctors themselves to adopt to telemedicine.
Yes, definitely. And I really wanted that each and every doctor who actually wanted to pursue their career in the digital management, they must have the course for the digitalization or the digital health. At least they can aware of that, how to utilize these communication tools and how these communication tools can be beneficial for them and the patients as well. So training of the doctors, not only the doctors, the training of the nurses, training of the other healthcare providers like the diabetes educators, the nutritionists, so that the people can save time and have a consultation with the nutritionist and get their diet plan while sitting in their office comfortably, instead of taking a leave from the office, or taking leave from the office so that their pregnant wife can travel with them and get a diet plan. All these things are possible, but the educator, nutritionist, and I must say that the foot care specialist, everyone has to train with the telemedicine concept and the utilization of the mobile apps.
True. I think again, the same thing I would say, that ongoing education and support are actually key for a smooth transition for doctors as well.
And this is the requirement of the current era.
True. Very rightly mentioned. Now, lastly, what is the role of remote monitoring programs and telemedicine, and what impact do they have on managing diabetes?
Yes, that I have mentioned earlier, that the remote monitoring program is like that. You can see that the diabetes, I must wanted to say that why the diabetes is so common globally. The biggest reason behind the diabetes epidemic disease is like the unhealthy lifestyle. The obesity is very much predator of this diabetes, behind the diabetes cause. So remote monitoring program is like that. By utilizing this remote monitoring program, again the physician can be in communication with the patient. Their glucose data can be monitored on the daily or the weekly basis. Their food data can be monitored on the daily or the weekly basis. Just like that, their blood pressures, their weight control can be assessed, their diet plan can be better assessed, their exercise journey can be better assessed. But the thing is that one thing is very important behind the remote monitoring program, what in the diabetes telecare we are providing. As I have mentioned earlier, that we have set the pop-up alert system customized to every patient according to their timetable. So what we do is that we do first the single consultation, and this single consultation is taking around 45 minutes to 60 minutes to one patient. And we took a complete detailed guidance and take a history and set the complete management plan. And after this plan, if the patient is willing to opt for the remote monitoring program because they are used to travel a lot, their one foot is in one country and their one foot is another country, so this remote monitoring program gives them benefit that they just need to enter the data and we will observe and we will guide them. So this is basically RMP that is actually better communicating. And if those patients who are actually living in that country where the CGM facilities are available, continuous glucose monitoring facilities are available, then though they enter their data, they check their blood sugar levels, and we can see the data and we can manage the according to the time in range, we can manage their sugar levels and manage their treatment plans.
Yes, I think it actually bridges the gap so rightly. I could understand the entire conversation.
Yes.
So now, thank you so much, doctor, for sharing your expertise and insights on telemedicine and diabetes management. And I think it is so evident that telemedicine is not just a convenience, but also vital tool in providing accessible and effective care. And I think everybody should adopt it.
Yes, definitely. And I just wanted to end our conversation with this, that don't think the telemedicine is just a video consultation, but the telemedicine is basically a tele education, tele-monitoring, tele-consultation, and the complete tele-health program. So this is basically the diabetic patient really need, and we come up with the better results. And that is basically the requirement of any clinician or any physician, that their patient data should be very, on the upward side, that they give the proper care and treatment to the patient.
Thank you so much, doctor, for sharing your expertise and insights on this vital but very trendy topic also. So thank you so much,
Thank you. Thank you so
doctor.
much. And thank you to
And
the MedSynapse team and Dr. Amit Kumar and everyone who really managing this platform by giving the digital education to healthcare providers and the common people.
thank you, doctor. And to our listeners, we hope you found today's discussion enlightening. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So, until next time, stay informed and stay healthy.